More than 20 years into civilian rule, medical professionals are worried that very little, if any, has changed in the health sector, considering the numbers on health indicators. This formed part of discussion at this year's scientific conference of the Nigerian Medical Association in Lagos. Sarah Ayiku reports.
In commemoration of the National Physicians Week, a minute of silence is held for scientists and doctors who have given their lives to the medical profession. It's a time of reflection as medical experts recite and reflect on their pledge and commitment to dedicate their lives to the service of humanity. Since 2020, healthcare systems around the world have been stretched beyond limit due to the COVID-19 pandemic. Countries are now expecting some respite as Nigeria wades through the third wave. Medical experts believe since COVID is not going anywhere soon, the health system needs to be strengthened in all its ramifications in terms of service delivery and capacity.
If you look through most of the institutions, you find out that the patient load and the service delivery has not remained the same when you compare pre-COVID era and now that we are in the COVID era and continuing. So we want a healthy environment where we can, a healthy environment that we have healthy rivalry, that is challenging, that has potentials that we can harness to be able to deploy our services. We want to do that. If those things are there, I'm sure people will do a rethink before they decide to go.
For more than 2 decades, Nigeria has failed in its Abuja Declaration commitment to ensure 15% of its annual budgetary allocation goes to health. From the budget proposal for 2022, defense and security got 15%, infrastructure 8.9%, education 7.9%, while health takes 5% of the entire allocation. The highest allocation for health so far has been a 6.2% share in 2012.
So have to start looking at ways to incentivize doctors and hold them into the country, improvement of infrastructure. We need to look into research and development within the country, because part of what we had issues with as well was we don't produce anything, and there are a lot of people that are smart enough to be able to do that. We have to start creating the avenue for people to be able to sit down, develop patents, prototypes, testing, reagents. It's possible, but I think it's something about sitting down and having a concerted effort and putting in the thoughts to develop our human resource.
It's not as if doctors are saying they can't do their job, but the only thing is that you don't necessarily expose yourself to unnecessary danger. There have been running battles between hospital staff, especially doctors, and hospital management, in which there is a consideration of economics, of how much protective devices we can provide for you, as well as the safety of how safe are these little that you can provide. And that has been a lingering conversation. And that is one of the areas where the welfare of doctors need to be improved.
Medical experts are asking the federal government to make health insurance compulsory for all Nigerians and primary health care the cornerstone of Nigeria's health system.